Hi, this is Dr. Fussell. All right, I'm a board certified urologist for over 20 years. We do male enhancement and erectile dysfunction. We do all these talks where we're trying to destigmatize male enhancement. So when you go listen to our talks, please share it because we're trying to get good information out there. And guys, when you come and hear our talks, you understand that this is an educational talk. We're trying to get out real information because there's so much crap out there. So come and see us. UroHard for Men. Horns up. Let me just say, I'm Dr. Melvin Fussell. I'm a board certified urologist for greater than 20 years. All right. And I've done all the stuff that urologists do. But now I just do two things. We do male enhancement and erectile dysfunction. And the company's name is UroHard. Uro, because urology, hard, H-A-R-D. All right, you can go and you can follow us on TikTok or Instagram or Facebook. So we're on all the social media platforms, including YouTube. We got our podcasts out there. We're doing blogs, all this other kind of stuff. So if you want to get more in-depth information, go to our website. Go read our blogs. Go to our podcasts and listen to what we have to say because we're giving you information that you're just not going to get sitting in front of your doctor. Why? Because your doctor's only got maybe like 10, 15 minutes to talk to you. All right? So they got other people waiting in the waiting room. And they got to get you in, get you out because they got to get to the next person. I was scheduled to be there at 8:30. Somebody else was scheduled to be there at 8:45. So you got 15 minutes for them to see you, get you out, check you out, and get another person in the room. And if that doctor gets behind and you're out there waiting for a long time, then you're upset, because it took too long for the doctor to see me. They're wasting my time. My time's important too. You know, it's tough out there. But I can tell you, when you come and see us, especially if you're seeing us for erectile dysfunction, we have a concierge service. So there's one flat fee, all right? Usually that's around about $200 just for erectile dysfunction. But the thing is that it covers you for the entire year. The entire year. There are no copays or anything like that, all right? So that means you can come back and see us. We can write prescriptions for you and all this other kind of stuff. So when you look at the big picture, actually it's less expensive to see us for erectile dysfunction than paying for your insurance. Why? Because every time you walk in the door in your other doctor's office, you got to pay a copay. And they expect it up front. Now, Lisa's telling me, reel it in, reel it in. Let's get to this talk. All right, now, guys, here's what we're going to talk about. How much bigger can you really get? Why? Because I do male enhancement, all right? And what I'm trying to do is I need guys to get honest expectations. So in this talk, we're trying to get rid of the hype. I want you to really get honest expectations of how much bigger can you really get. So let's talk about the question every prospective patient wants to ask, but often they're afraid to ask it. How much bigger, doc, can I really get? This is probably the most searched question about male enhancement. All right, because you're going to different places and you're all over the internet and you're trying to figure this out. The key is to keep it focused on realistic expectations, not the hype. So what we're trying to do is we're trying to get rid of the hype. Let's talk about realistic expectations. All right, so here we go. This is my opening hook. Let's address this elephant in the room. How much bigger can I really get? It's the number one question we get, and today, we're going to answer it honestly, not with marketing, all right? Not with exaggeration and all that kind of stuff, just realistic expectations. So let me take a poll out there for those that are listening, all right? If you were considering male enhancement, because I know a lot of you are, and you follow us for a long time trying to figure out if this is what you're going to do, what matters most to you, all right? Is it, do you want more girth? Do you want more length? Is it to better improve your confidence? Do you just want a natural appearance? All right. So if someone guarantees you you'll gain a certain amount, you should be skeptical. Yes, you should be skeptical when they start throwing all these guarantees out there. Because medicine doesn't really work that way. Why? Because everybody starts from a different place. I got guys that come in to see me, and some of them are above normal size, guys are below normal size. So if you want to get up to a certain size, it might take more than one treatment. All right. So why every patient is different, and let's get into that because of what I just said. It's the starting anatomy. What do you start from? All right, because everybody don't start at the same place. Then we got to get into things like the elasticity of your skin. All right, because we're using a filler. How much can we really do for you in this setting? And then how well do you heal? All right, is something going on with that affects your healing, like diabetes or all this other? And then the truthful thing is collagen production. We do things to boost your collagen production. All right, the tissue characteristics. Have you had any previous procedures? And then the thing that affects a lot of it all the time is following up on the post-op instructions. And why do I have to say that? Because we got knuckleheads out there. They got guys out there. I'll put it in writing. I'll tell them what to do. We'll tell them they got to send us pictures, and we still struggle trying to keep them on point following the post-op instructions when the healing actually happens. So the procedure may be the same, but the bottom line is the biology is different. Everybody's a little different. The same, but different. All right. Now, girth versus length. Because what we're talking about here is the girth procedure. Now, we make you bigger, longer, harder. Bigger is increasing girth. Longer is increasing length. Harder is erectile dysfunction. That's what we mean when we say bigger, longer, harder. We can make you bigger, longer, harder. So, let's talk about girth versus length. All right, one of the biggest misconceptions out there. The primary goal is to increase your girth. All right? Not significantly increasing your length. So if you have this girth procedure, it's about increasing girth. And I've talked to guys about this over and over about girth. All right, girth is where it's really at. You can have 10 inches hitting all the way to the back, but you're jiggling around like a pencil in a cup. I mean, you got to aim for the walls and all this. But what if you just got that big burrito that fills everything up? That's what we're talking about. All right. So actually, once we increase your girth, actually you are bigger and it's actually physically heavier. So yeah, guys, it does hang longer. And I tell guys, you're going to pick up size on not only size on our girth procedure, but it's going to hang longer in the flaccid state just because it's bigger. All right. So some patients say it looks bigger. Others say it feels bigger. But partners may describe the change differently than the patient. I can tell you your significant other, your partner is going to notice the difference. So here's my talking point. Understanding what the procedure is designed to accomplish helps prevent disappointment. That's why it takes so much time talking to guys. I want to know exactly what do you want. All right? Because that's what we're here for. This is cosmetics. We're focused on what you want. All right? So how much girth is realistic? All right? Because we know we're talking about girth now. But what's really realistic out there? All right. Typical ranges in our practice we always tell guys, you're going to get 3¼ to an inch on one procedure. You're going to get 3¼ to an inch. Now, what we do tell guys is that's actually on the low end. Because most of our guys are picking up 1.5 to 2 inches. That's a significant change. But that's what most of our guys are getting. All right? So, but we got to give you an average. That's why we talk about an average. And then the thing about it is that if you don't achieve our 3¼ to an inch, then we'll just bring you back and do another procedure. We're not going to charge you for that because you didn't reach our minimum. All right. So the thing is that we will bring you back and make sure you get that size that we told you we expected you to get. And that's 3¼ to an inch. But understand, we expect you to even get more than that. So now, because everybody starts at a different place, once you achieve your size, the question is, are you happy right there? Or do you envision yourself being bigger? What's so beautiful is that you can come back again after 90 days and increase your size even more. So you can repeat the procedure and pick up another 3¼ and an inch or more. Now, but that's up to you, because some guys tell me, Doc, I don't want to be too big, or she gonna be complaining, or whoever your significant other might be complaining. So you got a limit on how much you want to get bigger. So you may just want one treatment and you're great. But I got other guys out there that want multiple treatments. Guys, I've had it done twice. But I'm at a stopping point now. I don't want to be any bigger than what I am. I'm happy where I'm at. So the thing is that what I want to do is help you get to where you want to be. All right. So what happens if someone wants the biggest possible results? And I got guys out there that say, Doc, man, I want to be that elephant, hanging down there. I'm like, okay. Let's be realistic. Because when we do this and we're making you bigger, I got to make sure that it's balanced. All right. Because basically, I want to make sure it's the same size, it's the same, just a bigger version of you. All right. Trying to choose my words here so they don't cut me off. All right. So I got to make sure it's proportioned. All right. I want to make sure the shaft matches the head. I want to make sure that it looks natural. I want to make sure that it doesn't look deformed or anything like that. You're just a bigger version of what you already were. That's the goal. And I always tell guys, I say, look, when we start talking about this appearance, guys, we have to be realistic. Let me tell you something. What I run into a lot is that, and you've heard me say this before if you follow our talks, is that when a guy gets circumcised at birth, that's all he knows. He knows how he looks. He's not getting a chance to compare his circumcision to other people's circumcision. So he doesn't know if he got jacked up or if he got a very good circumcision. Circumcisions are usually done by the pediatrician. All right. And they'll do things like a gum coat clamp or whatever. And they clamp the little thing on you and they just run around and remove the skin and you go. All right. But the thing is that some guys' circumcisions look jacked. I mean, that skin is halfway down the shaft. Other guys' circumcisions are fine. But here's the catch. How you gonna know? What, you gonna pull it out and compare it to somebody else? Hey man, let me see what your circumcision looks like. Dude, you want to catch a right overhand. All right, that right hook. All right, so that don't swing here. So you don't have any comparison. You don't know if you got a jacked up circumcision or not. All you know is you want me to give you a natural appearance once I do male enhancement. All right. So here's the point. Sometimes the best result isn't the biggest result. It's the more natural one. And that's the whole thing. We want you to look naturally bigger. All right. So we're basically taking what you got and just creating a bigger version. All right. But here's the psychology. The psychology behind being bigger. All right. Hope this resonates with somebody. Why do men seek enhancement? Why? Was because you always thought you were small? Because of some mental trauma that might have happened? All right. Maybe it's because you just want to increase your confidence. Maybe because you lost your wife and you want to get back out there, but you're concerned about all the tension of being in that dating environment. Maybe it's just body image, I got big hands, big feet, but I'm small. So maybe it's that. Maybe you're just curious about what it would be like to be bigger. Maybe it's something to actually help you out with your self-esteem. I can tell you, I got guys coming from every direction, but you got to be you. Maybe it's just for your partner's satisfaction. All right. I can tell you when I tell guys, "Oh, I'm good, man," and then they turn to their wives and say, "Hey, honey, I'm good, right? Right, babe?" Any wife worth her salt is not going to embarrass her man and say, "Hey, no, hell no, you ain't good. You need to do something with that little sausage." All right. She's not going to do that. Not if she loves you. All right. And she'll say stuff down this line. You got to listen. "Honey, you're good, but if that's what you want to do, I'm fine with it." What she's trying to tell you in a nice way is, I would prefer to have more, but I'm not going to embarrass you. So if that's what you want to do, I'm fine with it. She's giving you the alleyway, right? Because she don't want to bruise your ego. That's what's going on there. So, an important point, a procedure doesn't automatically solve your confidence issues. So, we want you to get male enhancement, but it doesn't solve all your confidence issues. But it darn sure helps. I can tell you that for a fact. All right? Enhancement can change anatomy. It doesn't automatically change how someone feels about themselves. All right? So, there's a lot that's going on here. All right. So, what patients are most surprised by? All right. This is after they have the procedure done. I'm getting comments like, "It felt more natural than I expected." Yeah, it's you, man. It's all your natural tissue now, and it's permanent. The recovery required more patience. Yes, we're going to ask you to give us 40 days and 40 nights, all right, before you start having sex. But healing goes out to 90 days. "I wish I had done it sooner." Yeah, you do. Yeah, you do. You've been small all these years. You finally decided, "I'm going to get this done." And hey, you're loving your new size. I didn't realize how important aftercare was, because we stress aftercare. We stress it. You got to send us pictures every 3 days. I mean, if you just want some willy-nilly, "I'm going to come and get it," and go do your own thing, this is not the place for you. You got to stay in contact with us all during the 40-day period. All right? My partner noticed the difference. Yes, you will. She going to notice the difference. I got partners out there telling guys, "You can't go back for a second or third time." Why? Because you're maxing her out. But I always tell guys, look, push her to the edge, but don't let her fall. That's my little thing. You want to take her right to the edge. All right? My confidence changed more than I expected. Yeah, I got guys walk around just like that after they have this procedure done. And I love it, man. I love it to boost somebody's confidence on that level. These are some questions that we get every day. Can I request a certain size? Yeah, you can. But the thing is, it depends on where you start. And what do we got to do to get you to where you want to be? Can I go too big? Yeah, you can. I always tell guys, once you get up over 6.5 inches of girth, and I say, "Hey, take out that dollar bill, roll it up from end to end, see what 6 inches looks like." Once you get around 6.5 inches, most can't accept your size. So, guys that want to be 7'8", dude, you're out there. You're out there, and the majority can't handle it. Can I add more later? Hell yeah, yes you can. You can come back and we can get you bigger and bigger and bigger. That's the thing. Will it look natural? Yes, that's our whole thing. We want you to look totally natural, just bigger. Will people notice? Well, they're going to notice if you're showing it off. I mean, are you that guy out there wearing gray sweatpants? They looking at them gray sweatpants, man. You know what I'm talking about. Do my partner notice? Yeah, your partner's going to notice. She's going to notice. How long until the final results? Well, like I've said before, first 40 days, no sex. No oral, no anal, no nothing. Now you can start using it. But healing goes out to 90 days. So give us 90 days. All right, let me bust some myths because there's always stuff out there that people making up. Here's one myth. Everyone gains the same amount. And no, they do not. That's why we say 3¼ to an inch. All right, but that's on our low end. We expect you to get 1.5 inches, 2 inches. And a lot of it comes down to how well are you managing what you do. I mean, if you're a heavy smoker, you could attenuate some of the size that you would gain. All right, so I always tell guys, hey, cut back on the smoking. All right, bigger is always better. And that's not true. Bigger is not always better. And I'm a male enhancement doctor, and I'm telling you now, bigger is not always better. All right? But I can tell you one thing. I'd rather be bigger than smaller. All right? So there's a balance here. Healing affects the final outcome. Now that, my friend, is true. Do you follow the directions that we gave you? We're very strict because we're looking for those great outcomes. One procedure guarantees your dream size. No, it does not, because everybody starts at a different level. So we got to get you up to what your dream size is. Realistic expectations improves satisfaction. And that is completely true. That's why I'm having these talks, because I'm trying to help guys get realistic expectations of what can really happen or where we can really get you to. All right, now, I'm wrapping this thing up here. All right, so understand this. The goal isn't to make everyone look the same. Why? Because everybody doesn't look the same. The goal is to create a result that's appropriate for that individual. All right, so it's an individual thing. We're trying to help you get there. So now, we started this whole thing off asking, how much bigger can you really get? And if you listen to my whole talk, you'll know that, hey, I can get you to just about whatever you want to be when we talk about girth. Length is another thing. If you want to be down to your kneecap, then understand that you have to be realistic about that. Can we get it longer? Yes, we can get it longer. And that's usually our ligament release procedure. But realistically, we're going to help you pick up maybe 1 inch, 1.5 inches, and that's going to be noticed in the flaccid state, but that's not necessarily what's going to happen in the erect state, And there's controversy in the literature, but the literature says usually your erectile length is about the same. All right? But the thing is it going to hang longer? Yes, it is. Yes, it is. Yes, it is. So, Lisa, because people know your name out there, I'm wrapping up this talk, and I want to know if there are any questions. I know we started late, so we kind of missed our big crowd that's usually waiting for us. Do you have any questions out there?
There's been a lot of questions, but I've been answering them as we go. People want to know how much it is. Are the results permanent? Does it treat erections?
All right, so Lisa's been answering those questions, so you can go and actually look at, the thread and see what's been some of the questions. So she's giving you constant feedback and all this other kind of stuff. For those of you that don't know Lisa, she's a board-certified nurse practitioner in urology for over 20 years. All right, so she got the credentials. She's been doing this for a long time. And now, just like me, part of my team, we're both doing cosmetic urology. So we're not doing the stuff out there like following your PSAs and all this other kind of stuff. We're sticking to male enhancement and erectile dysfunction. So thank you for tuning in with your time. And if you got more questions, just hit us up, or you can just call the office. All right? 478-225-9324. Pick up the phone and give us a call. It's a free consultation to ask us questions. All right? So ask questions, because I know you want to know. You sitting out there, you get out the shower and you look in the mirror, you're not happy. You're in the locker room and you're grabbing a towel trying to cover up. You ain't walking around just swinging. You ain't have no intentions of going to the nudist beach. Why? Because you're concerned about your size. Hey, come talk to us and get some realistic information. Yeah, until then, guys, you know what I say. Horns up. Keep them horns up.